Why isn't there early screening for pancreatic adenocarcinoma? Imagine trying to catch a tiny, sneaky threat before it causes trouble, but the tools just aren't quite there yet. That's the challenge with early screening for pancreatic adenocarcinoma, the most common type of pancreatic cancer. This disease is quite rare compared to other cancers, so screening everyone would lead to many false alarms and unnecessary procedures. That's why medical guidelines recommend screening only for people at high risk, like those with a strong family history, certain genetic mutations, or inherited conditions like hereditary pancreatitis. These individuals usually start screening between ages 35 and 50, depending on their specific risk factors. One big hurdle is that we don't have a simple, reliable, and non-invasive test to detect early pancreatic cancer. Unlike breast or colon cancer, which can often be found with mammograms or colonoscopies, pancreatic cancer lacks a quick blood test or easy imaging method that can spot early signs with high accuracy. Imaging techniques like endoscopic ultrasound or magnetic resonance imaging are used for high-risk groups, but they are costly, requiring specialized equipment, and aren't practical for screening everyone. Adding to the difficulty is how pancreatic adenocarcinoma develops. It often grows deep inside the pancreas and tends to progress rapidly. Usually, symptoms don't show up until the cancer is advanced, making early detection tricky. Small precancerous lesions are hard to see with current imaging tools, which means the window for catching the disease early in the general population is very narrow. Screening also carries risks. False positives can lead to invasive procedures like biopsies or even surgery, which have their own risks and complications. Pancreatic surgery is complex and can cause significant health issues, so doctors must carefully weigh the benefits of screening against these potential harms, especially for those without a high risk. Right now, efforts are focused on surveillance programs for people at high risk. These programs involve regular imaging and sometimes blood tests to monitor for early changes. Researchers are working hard to develop better tests, including new biomarkers and improved imaging techniques, but these are still in the experimental stage and not yet ready for widespread use. In summary, the reason we don't have universal early screening for pancreatic adenocarcinoma is because of its rarity, the lack of effective and practical tests, its aggressive nature, and the potential harms of screening procedures. For most people, early detection remains a challenge, but ongoing research offers hope that in the future, we might be able to catch this disease earlier and improve outcomes. Always remember, if you have concerns about your risk, consult with a healthcare professional who can provide personalized advice based on your health history.